Anatomy of external ear. The ear itself is divided into three parts: the external ear, the middle ear, and the internal ear. The parts of the external ear include three parts: the pinna, external auditory canal, as well as the tympanic membrane. The tympanic membrane is called the eardrum. The pinna is the visible part of the ear. The external auditory canal is a connection between the both. The auricle of the pinna, or pinna. It is made up of a single yellow elastic cartilage, except at the lobule, where the yellow elastic cartilage is going to be absent. The lateral surface of the auricle. It is characterized by a lot of elevations and depressions, such as helix, antihelix, tragus, antitragus, scaphoid fossa, and so on. Now, clinical feature is that the ears could make better unique IDs when compared to fingerprints. Basically, the elevation and depression seen in the pinna are going to be extremely rare in fingerprinting technology, which basically means that even identical twins will have different characteristic prominences of the pinna. Cartilage of the pinna. Now, this cartilage of the pinna is going to be continuous with the cartilaginous part of the external auditory canal, although it is covered by the skin. Now, the skin is going to be closely attached on the lateral surface, whereas slightly loosely attached on the medial surface. However, the cartilage of the pinna is slightly avascular, and thus it derives its nourishment or the blood supply from the perichondrium covering it. Oops, because the perichondritis pinna, right? So there's inflammation of the perichondrium, which in turn screws up the blood supply and thus the nourishment of the pinna as well. Clinical importance of the external auditory of the external ear or the pinna. There is stripping of the perichondrium from the cartilage, as occurs following injuries that cause hematoma. Now, these causes necrosis called the boxer's ear. Haha, boxer's ear. Okay, moving on to the landmarks on the pinna. About the external ear, there are going to be three main landmarks: the suprameatal triangle, also known as the McEwen's triangle, the scaphoid fossa, that is the incisura terminalis, and third is the symba concha. The symba concha is the area between the crest of helix and the antihelix. The clinical anatomy is that it's the most important landmark in mastoid surgery. McEwen's triangle. McEwen's triangle is a triangle which overlies the mastoid antrum, and the mastoid antrum lies 1 centimeter deep to it. Now, the boundaries of the McEwen's triangle include the temporal line, the posterior superior wall of the external auditory canal, and the tangent drawn from the external auditory canal. Incisura terminalis. Now, this is the part of the pinna which is devoid of the cartilage, and it is present between the tragus and the anterior crura of the helix. Clinical importance is that endoral approach of surgery can be done through this thing. Basically, to enter the ear is endoral approach. Nerve supply of the pinna. So the nerve supply of the pinna is going to be by 4 different nerves in different places. Majority of the pinna is supplied by the greater auricular nerve, whereas a few part of the pinna are going to be supplied by few other nerves. Lymphatic supply. Preauricular lymph nodes, mastoid tip nodes, and upper deep cervical nodes are going to be the lymphatic supply. Clinical correlation. Now, there is the cartilage of the pinna. This cartilage of the pinna are going to be used for septoplasty, that is the rhinoplasty procedures, and also for tympanic membrane, such as tympanoplasty. Moving on to the second part of the external ear, that is the external auditory canal. The external auditory canal has 2 parts: the outer 1/3 and the inner 2/3. The outer 1/3 is called the cartilaginous part, and the inner 2/3 are called the bony part. And in between, there is the isthmus, and towards the end of the external auditory canal lies the tympanic membrane, between which is going to be a recess called an anterior recess. Cartilaginous part of the external auditory canal lies over here. The clinical anatomy of the cartilaginous part. The cartilaginous part of the pinna has a lot of sebaceous glands. It also has a lot of sebaceous glands, ceruminous glands. It does possess hair follicles, which in turn will cause furunculosis, that is inflammation of the hair follicle. As well, there are two foramens when we talk about external auditory canal. One foramen present in the cartilaginous part of the EAC, and one in the bony part of EAC. The one in the cartilaginous part of the external auditory canal is called the foramen of Santorini, and the one present in the bony part of the EAC is called the foramen of Hoschke. Through these foramens, the infection will spread to the mastoid and parotid. Moving on to the bony part of the EAC. Bony part of the EAC is marked in this figure in a red color. So this bony part of the external auditory canal is going to be at utmost importance, but then there are no hair follicles present over here. As a result, there is no furuncles. Now, the bony part of the external auditory canal has a foramen. It's called the foramen of Hoschke. Clinical importance. Over here also, the foramen of Hoschke is going to connect the middle ear with the temporomandibular joint that's causing infection in that particular joint. Moving on to the nerve supply for the external auditory canal. The anterior wall and the roof is supplied by the auriculotemporal nerve. The floor and the posterior wall are supplied by the vagus nerve. That is the auricular branch of vagus, which is also known as the Arnold's nerve. Clinical importance. Heiselberger sign. Heiselberger sign is a sign where there's going to be hypoesthesia of the wall of the external auditory canal. It is seen in a lot of diseases. Moving on to the third part of the external ear, that is the tympanic membrane. The tympanic membrane has a lot of folds, but majoritarily, the tympanic membrane is divided into two parts, the pars tensa, the pars flaccida. The pars tensa is the most of the part, but however, it is going to be located in the lower part of the tympanic membrane, whereas the pars flaccida is the flaccid part, and the minority part, it is going to be in the top of the tympanic membrane. The pars tensa is having a central indentation, otherwise called the dentation. Now it is called the umbo. Basically, the handle of the malleus comes and clings onto it at the center. Peripherally, however, the pars tensa is thickened to form annulus tympanicus, which is attached to a bony part called the tympanic sulcus. The pars flaccida is also known as the shrapnel's membrane. Now this is going to be present just like that. Parts of the tympanic membrane. The pars tensa, we can see the notch of Venus. Pars tensa. It's not the notch of Venus. Okay, just remember. Pars tensa. Pars tensa, coniflight, umbo, and annulus are going to be seen. And the pars flaccida, there's a space called the Persac space, and cholesteatoma is going to be more common here due to retraction bucket formation. The tympanic membrane as a whole has 3 layers. The layers include the outer epithelial, the middle fibrous, and the inner mucosal layer. The outer epithelial layer is going to be continuous with the outer external auditory canal, and the inner membrane, that is the mucosal membrane, that is going to be continuous with the middle ear mucosa. And the middle fibrous layer is going to be irregular in case of pars flaccida. That is going to be the reason for its flaccidity. Nerve supply of the tympanic membrane. The lateral or the outer surface is divided into anterior and posterior halves. The anterior half is supplied by the auriculotemporal nerve, whereas the posterior half is supplied by the vagus nerve. Now these two, as you can recollect, are the nerve supply for the external auditory canal as well. The medial wall, that is the medial or the inner side of the tympanic membrane, is going to be supplied by the tympanic branch of glossopharyngeal nerve. Oops, that's all. It's also known as the Jacobson nerve. Thank you. Please give this video a like button if you really like it. See you soon.